Hi guys, my name's Heather. I'm a hygienist here with GuruNanda, and today we're going to talk about how often you should get your teeth cleaned. Is it every 6 months, every 3 months, 4 months, or is it once a year? The answer actually varies for different types of people, and it depends on the health of their mouth. So the generic answer would be everyone should get their teeth cleaned at least twice a year. Now, if you have active gum disease, like gingivitis or periodontal disease, it's advised to get your teeth cleaned every 3 to 4 months. If you have gingivitis, 4 months is okay, but if you have periodontal disease, every 3 months is what's recommended. Now, why is that? So the bacteria in your mouth gets disrupted after the teeth are professionally cleaned. We go underneath the gums, disrupt the biofilm that sits on the teeth, and that's where the bacteria live. The bacteria live in that biofilm, and that's what's contributing to the progression of disease. So after that biofilm and bacteria have been disrupted, it takes about 3 months for that bacteria to repopulate and regrow. So we like to get you in at that 3-month mark to help prevent the disease from getting any worse. There are cases now where sometimes if someone has gingivitis and they're coming in every 4 months to get their teeth cleaned and the disease reverses back and they have healthy gum tissue again, they're able to come in every 6 months. A lot of the times the patients just like to stay on top of it and come in every 4 months so they don't get gingivitis again. Yeah, so it is possible for gingivitis to reverse, and then you can come in every 6 months. But rule of thumb, if you have healthy gum tissue, come in every 6 months. Gingivitis, come in every 4 months. And then if you have periodontal disease, come in every 3 months. Okay, that's it for today. Any questions, leave them down below, and I'll talk to you in the next video. Bye.